This is no laughing matter. 80 million people, 80 million could lose their employer-backed health plans under Obamacare. Add that to the millions who've already lost their plan. Doctors being kicked off plans. What does all of that mean for our hospitals? Let's ask Congresswoman Diane Black. She's a registered nurse for more than 40 years. Diane, you had experience in the emergency rooms, I think. So I want you to tell us and our viewers, what's the impact of Obamacare on emergency rooms? It was supposed to relieve the pressure because people will now have insurance so they won't go to the emergency room. Is that what's going to happen?
Well, good morning, Stuart. It's great to be with you. And you're exactly right. What is happening already, and it's odd that I'm on today because yesterday I spent the day out in the district, and one of the places that I visited was a hospital in my area that is a community hospital. And I asked the administrator, what are they seeing already as a result of the individual policies that are being canceled or people finding that their premiums are going up? And they are already seeing an uptick of emergency room use. And I asked them, is it appropriate use? And they're saying, well, not really. I mean, these aren't like emergency cases that really should be in the emergency room. These are just people that are seeking care because they've lost their care. And we're going to just see this getting worse. This is going to be a real problem in our emergency rooms.
All right. Now, you know firsthand about the quality of care. What will Obamacare do to the quality of care for the average American?
Well, first of all, let's talk about the emergency room, because what you're going to see is you'll see people that don't know where else to go. And so emergency rooms are open 24 hours a day, 7 days a week. They never close. People will inappropriately use the emergency room because frankly, many of them will not know where to go. They won't have the coverage. And so it makes it difficult because you have to triage when people come into the hospital and decide who needs to be seen immediately that should be in the emergency room. And you can get backlogs, and it really does become a difficult situation when you have an emergency room full of people and you're trying to maintain that with the staff that is there for emergencies. So it doesn't do anything for the quality of care.
Outside the emergency room, outside the hospital,
yes.
What about the quality of care on the ground floor? Because we hear a lot of talk that there's going to be a two-tier system, one for relatively okay people with money, and another system, inferior, for the rest.
I don't know that we could even look and see what's going to happen in the future with where we're going in dismantling a system that we don't have a plan for. We have physicians who are not any longer in plans, so you can't go to the doctor that you have confidence in and that you've known for a long time. We're going to see services that are going to be denied because people don't have the money to pay for them. I am very concerned about where we're going with our healthcare system. 80 million additional people losing their insurance. I think this is going to be catastrophic to our system and, more importantly, to people trying to find care.
Congresswoman Diane Black, we always appreciate you being with us because you know what you were talking about. You have been there, and we appreciate that.
I may have to put my uniform back on and go to the hospital and help out with so many of these cases.
Well,
but thank you for having me.
That bad. Whoa. All right. We appreciate it. See you again soon.
Thank you.
President